No, you can't do that. Keep dreaming. These are some of the statements that many of us face throughout our lives, whether it's from teachers, coworkers, family members, to job employers. For many of us, it is easy to overcome these statements, to obtain our goals in life. But imagine being told that because of your physical capabilities or appearance, things that you just can't change, you were born with. The United Cerebral Palsy Foundation states 800,000 children and adults in the United States are living with one or more of the symptoms of cerebral palsy. As a direct support professional working with developmental disabilities, I have had the honor of working with a few individuals with cerebral palsy. Are their lives easy? No. Are their lives worth living? Yes. Today I'm here to talk to you about cerebral palsy, how it is defined, how it presents itself, and how those struggling with CP live with it. So, I would like to give you a brief explanation of what cerebral palsy is. So what is cerebral palsy? Cerebral palsy describes a group of permanent disorders of the development of movement and posture causing activity limitation that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. Dr. Chok Won Chon, 2016. So the term cerebral in cerebral palsy refers to the two hemispheres of the brain. The term palsy refers to lack of impairment or loss of impairment or motor function. It is not progressive, it is not a disease, and it is not contagious. Cerebral palsy is usually caused by events early in the development of the fetus, or early in childhood. It is the most common childhood physical disability and affects 2 to 2.5 children per 1,000 born in the United States. Krieger, 2006. It affects the brain, causing abnormalities. It also disrupts the brain's ability to control movement or posture. So that's why sometimes you see those with cerebral palsy with a fixed posture, maybe to one side or to the other. Damage is usually not repairable, and unfortunately it is usually permanent. But it is not progressive. So given a brief definition of cerebral palsy, let's look at some of the symptoms it may present. How is cerebral palsy presented symptomatically? Cerebral palsy has a huge effect on the individual's muscles and coordination. Lack of muscle coordination, known as ataxia, is one of the symptoms, following stiff or tight muscles, exaggerated reflexes, known as spasticity, excessive drooling, difficulty swallowing, involuntary movements, and motor function. Everyone varies on the symptoms they present when diagnosed with cerebral palsy. Some may require short-term care versus long-term care. Some may require adaptive equipment versus no equipment necessary. And some may be completely independent versus those who require assistance working towards their independence. In 2008, the Centers for Disease Control and Prevention stated that 58.2% of children with CP could walk independently. 11.3% walked using a handheld mobility device such as a walker or crutches, and 30.6% had limited or no walking ability. As we have looked at some of the symptoms of cerebral palsy, as there is many, how does one live with CP? Can cerebral palsy be cured or prevented? The answer is no and yes. Although there is no cure for CP, it can be treated. Usually involving early detection increases our likelihood, or those with cerebral palsy, the likelihood of overcoming obstacles they may face later in life. Treatment plans are usually not standardized, and require a wide variety of healthcare professionals to create these plans. Some treatment plans may include specialized therapies such as physical therapy, occupational therapy, speech therapy, and many more that target specific symptoms and trying to not necessarily cure the symptom, but to better control it. Drugs may also be used, which are typically localized to decrease spasticity or uncontrolled movements and to lower pain. Some more extreme approaches may require surgery, and specialized devices, aids, and equipment may be used, which could range from, like I said before, using crutches, walkers, or wheelchairs. So with the info I have given you related to definition, symptoms, and treatments related to cerebral palsy, I would like to leave you with this. Cerebral palsy affects many children into adulthood. With the variety of physical and mental impairments it presents and the severity of treatments, it may be almost impossible to live a life comparable to those without disabilities. With a great support team, however, and a wide variety of options, those with cerebral palsy can live a quality life that is worth living with an increased chance of future difficulty. I have witnessed firsthand the unbelievable strength and courage those who face CP have in accordance to pushing forward. Individuals with CP have encouraged myself to be more optimistic and grateful, as with limited opportunities and abilities, they are some of the most amazing people I know today. Thank you.